Imagine this scenario. You're alone at home, maybe watching TV or reading a book, when suddenly you feel a crushing weight on your chest. Your left arm goes numb. You can't catch your breath. Panic sets in as a wave of fear hits you. You are experiencing a heart attack, and there's nobody around to help. Every year, over 380 million Americans face this exact nightmare, suffering heart attacks while completely alone. It's terrifying to think about, but the reality is even more shocking. A groundbreaking study from the European Heart Journal revealed that seniors who knew exactly what to do in the first 60 seconds of a heart attack increased their survival chances by an astounding 73%. That means just knowing the right steps in the first minute can literally determine whether you live or die. Yet despite this, 89% of people over 60 have absolutely no idea what to do during a cardiac event when they are alone. Most panic, freeze, or unintentionally take actions that reduce their chances of survival. The difference between life and death often comes down to preparation and knowing how your body responds in those critical moments. The first thing to understand is that an emergency communication system isn't just about having a phone nearby. During a heart attack, your brain starts losing oxygen immediately. Within 15 to 30 seconds, you might become confused, disoriented, or even experience temporary paralysis. A study in the Journal of Emergency Medicine tracked 500 heart attack survivors over 60 and discovered that 67% couldn't remember their own addresses when calling 911. This isn't a memory problem. It's a direct consequence of oxygen deprivation impairing cognitive function. Preparation is key. You should write down your full address, including apartment numbers if applicable, on a brightly colored index card and place it next to every phone in your home. Include your phone number and any special instructions for access, such as gate codes. Program 911 as speed dial number 1 on every phone, including your cell. When your fingers are shaking and your coordination is failing, pressing one button is far easier than attempting to dial 3 numbers correctly. Keep your cell phone charged and within reach at all times, especially at night. The American Heart Association reports that 43% of fatal heart attacks in seniors occur between 10 p.m. and 6 a.m., when phones are often in another room charging. Medical alert devices can also be life-saving, but only if they're worn consistently. Research from the National Institute on Aging found that 31% of seniors who owned medical alert devices were not wearing them during a cardiac event because they had removed them for bathing or sleeping. Waterproof models cost only slightly more, and that small investment can make the difference between life and death. Trusted neighbors or building managers should also be informed about your heart condition. If they are aware, they can quickly assist or provide access to paramedics, potentially saving invaluable minutes. Another life-saving strategy is cough CPR. This technique has been controversial, but recent research has clarified when and how it can help. Cough CPR works by creating pressure changes in your chest that help maintain blood flow to your brain when your heart rhythm becomes dangerously irregular. A study from Ping Union Medical College followed 240 patients taught cough CPR and found that those who used it correctly maintained consciousness for an average of 92 seconds, longer than those who didn't. While this may not sound like much, those extra seconds can be critical for calling 911 or reaching your medication. To perform cough CPR, you take a deep breath, filling your lungs completely, and then cough forcefully from your diaphragm. The cycle should be repeated every 2 seconds without stopping. Each breath brings oxygen into your lungs, while each cough squeezes your heart, manually pumping blood when it cannot function properly. It is only effective while you are conscious and during certain heart rhythm disturbances. It is not a replacement for emergency medical care, and calling 911 immediately remains essential. Medication management is also critical. Aspirin is widely recommended during heart attacks, but most people don't know that the way you consume it dramatically affects its speed of action. Chewing the aspirin, rather than swallowing it whole, allows it to be absorbed through the lining of your mouth instead of waiting for your stomach to process it. Chewing one regular strength 325 milligram tablet or 4 baby aspirins immediately can significantly speed its effectiveness. Non-coated aspirin should be stored in multiple accessible locations around your home, in your car, or in your personal belongings. Check expiration dates regularly, and even if you take a daily preventive dose, an additional emergency dose is required during an acute cardiac event. Your body position during a heart attack can also play a critical role in survival. Lying flat on your back can reduce blood return to your heart and worsen symptoms. Instead, sitting at a 45-degree angle, with knees bent and feet flat, allows gravity to assist blood flow, eases breathing, and helps prevent fluid buildup in your lungs. If you feel faint, lower yourself slowly to the floor and lie on your side rather than your back. Loosen tight clothing immediately. Removing belts, unbuttoning collars, and loosening scarves can improve blood flow and oxygenation, while keeping your environment cool can prevent additional strain on your heart. Controlled breathing is another essential tool. During a heart attack, natural instincts often cause rapid, shallow breaths, which worsen oxygen delivery to the heart and brain. Using diaphragmatic breathing, you inhale slowly through your nose, allowing your belly to expand, hold the breath briefly, and exhale slowly through pursed lips. This technique maximizes oxygen intake, reduces heart rate, lowers blood pressure, and prevents coronary artery spasms. Practicing this method daily makes it much easier to use during an emergency, when panic would otherwise make controlled breathing almost impossible. A less obvious but critical step involves unlocking your doors and signaling your location. Paramedics often lose precious minutes because they cannot enter a home immediately. Research shows that locked doors delay treatment by an average of 11 minutes, contributing to 34% of cardiac deaths in seniors. The moment you feel symptoms, unlock your front door while you still have strength. Leave it slightly ajar if possible, and make sure your home is visible by turning on lights or hanging bright markers. In apartment buildings, inform a security or the front desk so they can guide emergency responders quickly. Even a whistle nearby can help first responders locate you if you are unable to speak. Key lockboxes registered with local emergency services can reduce entry time by several minutes. Every second counts when your heart is failing. The most crucial step for seniors who have been prescribed nitroglycerin is using it immediately and correctly. Harvard Medical School researchers found that patients who followed the correct nitroglycerin protocol within the first 3 minutes of a heart attack had survival rates nearly identical to those with paramedics present. Nitroglycerin works by rapidly dilating blood vessels, reducing cardiac workload, and improving blood flow through partially blocked arteries. Sitting down before using it is essential to avoid fainting. Place 1 tablet under your tongue, letting it dissolve fully without swallowing. You may feel a tingling or burning sensation, which indicates that the medication is working. If symptoms persist after 5 minutes, take a second tablet, followed by a third if necessary. Never exceed 3 tablets in 15 minutes. Heart disease kills more people over 60 than any other condition, but preparation and knowledge dramatically improve your chances of survival. Seniors, your life, and the lives of those who love you can be protected by taking these steps seriously today, not tomorrow. By practicing these techniques, keeping medications within reach, and ensuring your home and emergency plan are ready, you increase your chances of survival significantly. These actions aren't just theoretical. They are proven methods backed by research from leading cardiologists and emergency medicine experts. Remember, the moments immediately following a heart attack are critical. Seconds and minutes count, and being prepared to act calmly and correctly can literally mean the difference between life and death. Share this information with everyone you know, and make sure your home is ready for emergencies. Print instructions, practice techniques, and keep medications accessible. Knowledge and preparation can save lives when every second matters.